Thereafter, you shifted to AIMS, I understand.
Ji, sir. Then I shifted to AIMS. I was in project earlier, and then
Yes.
there were two projects I did, and then shifted to the PhD program, and then worked there as a clinical psychologist for 3 years.
Wonderful. Wonderful. With whom, Dr. Lal or Dr. Gauri Shankar?
Uh, my chief guide was Dr. Sujata Satpathy, and co-guide was Dr. Rajesh
Okay.
Sagar. Uh,
Vandana ma'am,
huh,
we will start exactly at 8.
sure, sure, sure. People will keep joining, I think.
Right. 20 participants have joined.
Okay. Actually, I wanted to share. My PPT has a video option. I hope it plays during the session. Uh,
Why do you have doubt that it will not be, it will not work?
yeah, that's also a good way of looking at it.
Gita, you started giving the lesson of acceptance right now.
I think
Yes.
that's the best part in ACT that we learn from each
Yes.
other.
Yes.
Yes, definitely.
Yeah, Dr. Vandana, we have made you the co-host, so now you have the sharing rights as well.
Sure. I'll just
Just
share.
you can check it once.
Sure.
So first I'll stop sharing, then Vandana ma'am can share her PPT. Yes.
Oh, what happened? You can see
Yes, it's visible.
visible.
Yes.
So, do I have to allow people?
To enter
Because
into the meeting?
yeah, or you would do that because I think there is a continuous request.
No, no, rest everything will be taken care by our organizing team. You just have to focus on your presentation. That's it.
Okay. Yeah. Thank
Yeah,
you. Thank you
we
for the
will take care of
assurance.
everything.
Sure.
Yeah.
Sure.
Vandana ma'am, now you can stop your
You were saying something, Geeta?
Now you can stop sharing your PPT.
Okay.
I'll be sharing
Oh,
the few introduction.
ठीक है, ठीक है. Sure, 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 sure. I'll do that.
मैं बाद में ही देख लेती हूँ हेलो
हाँ, आवाज आ रही है। आवाज आ रही।
ಯಾರಲ್ಲಿ ಮಾಡೋದಂದ್ರೆ ಔಟ್ಲೈನ್ ಮಾಡಷ್ಟೇ ಸರ್.
Ma'am, I think we can start now.
So we can start now.
Yes,
And
ma'am, definitely.
we
It's the
have total
time.
50
Yes, Geeta.
participants. Okay. So very good evening,
We can start,
everybody.
ma'am.
Okay. So a very good evening, everyone, and a very warm welcome to all present. Warm welcome to all present here. I'm Dr. Geeta Singh, moderator for this first lecture of the lecture series named Reflection. So Reflection is the masterclass in mental health, an initiative taken by the Indian Mental Health and Research Center, IMHRC, Lucknow, basically with the purpose to bring together the subject experts, professionals, and the scholars to foster discussion on the intricacies and the diverse perspective on mental health related concerns. So the topic for today's lecture is trauma focused acceptance and commitment therapy. And as an expert on this topic, we have with us Dr. Vandana Choudhary. Dr. Vandana Choudhary, one second. Let me show. Oops. I'm unable to change the slide. There is some technical problem. I'm unable to change the slide. Yes. So Dr. Vandana Choudhary is a RCI registered clinical psychologist and currently running her organization, Swayam Psychotherapy Center in New Delhi. She has completed her PhD from All India Institute of Medical Sciences, AIMS, New Delhi. Her key areas of interest include trauma assessment and intervention in women and children, culturally sensitive practices in psychotherapy, public mental health, and post-traumatic growth. She has been a gold medal holder and received Dr. Bakshi Award, Helmut Ramskrit Research Fellowship, and International Council for Science Fellowship for the excellent research studies. She has been a member of the expert group for formulating national documents, especially during COVID times. She has more than 30 national and international publications and has contributed to drafting the country's policy documents and has co-authored a book for counselors on psychological trauma assessment and intervention in child abuse. She has led multiple research projects in association with national and international bodies. She is also a member of various prestigious national and international organizations. I welcome you, ma'am. And as chairperson, we have with us a very senior and esteemed professor from the field of mental health, Professor S.Z.H. Zadi Sir. Sir is head and director, Department of Clinical Psychology, Amity University, Lucknow campus. He's a licensed clinical psychologist with more than 42 years of experience in teaching and clinical practice. He is also alumni of Central Institute of Psychiatry, Ranchi, and also trained in NIMHANS, Bangalore, and Mental Health Department of Strathclyde Council, Glasgow, UK. He has worked as faculty in CIP Ranchi, Deputy Director in Rehabilitation, Government of India, Executive Director, NAB Mumbai, and also consultant clinical psychologist in Indian Air Force. He has several publications to his credit. He is also one of the board members or advisors for the Journal of Annals of Neurosciences. He is the recipient of very prestigious National Award for Outstanding Work in Empowerment of Person with Disability given by late Dr. APJ Abdul Kalam, ex-President of India, on 3rd of December 2006. Kindly mute yourself. He is also recipient of C.S. Kang Oration Award 2019. I welcome you, sir. And with this, I request Zadi sir to kindly chair the lecture of this lecture series called Reflections. Over to you, sir.
Thank you very much, Dr. Geeta, and all the organizers, particularly the one who has hosted this program, initiated this program, conceived this program. It is a very welcome and good idea to have a series of lecture on different topics and arranging the interaction between professors and senior professionals and the young scholars. And particularly, I'm thankful for making me as the opening batsman of this series. I do not know whether I will be bowled on the duck a zero or will continue for a couple of balls, but definitely I feel quite honored to be the part of this historical event. Dr. Geeta has already introduced learned speaker Dr. Vandana and her area of interest. She is going to speak about trauma-focused acceptance and commitment therapy. For my young fellows, professionals, and students, particularly, I'm seeing a good number of students are there. I'm sure that the seniors are fully aware of this concept. It was 1980 when Slave Hess, a professor of psychology in Nevada University, USA, who himself was suffering from periodical and continuous panic attack, anxiety attack, and related emotional issues, and was thoroughly fed up of all type of therapies and was not getting rid of it. So he thought that instead of struggling for getting rid of it, why don't I try to accept it and live with it? And from that, his personal experience, he started working and thinking and developing the techniques and procedures which would facilitate any individual having suffering or having continuous negative thoughts, that instead of ignoring or denying or fighting with this, he should accept it as a reality, and in spite of that, he should continue living with the happy life and with a lot of enthusiasm and ideals which he might have otherwise if he would not have the thoughts with his family and cultural backgrounds and acceptance and expectations. He should start living full, useful life, even with that thoughts which might be illuminating and maybe disturbing him. So with this idea, he has developed a series as the adjunct or as a third wave of the famous cognitive behavior therapy. So it is also quite link with the process of cognitive behavior therapy, where there's acceptance and choice and the action taken and all these things, means that what beliefs you are giving and how you can overcome with this or may not overcome with this, but still you live with it. And and above and all, the process of basic fundamental thinking of mindfulness, that live with present, don't with the tears about the past and the fear about the future. So live with it, live with whatever thoughts you have. And I'm sure that Dr. Vandana will give you a lot of information. My only concern with Dr. Vandana is that since she is an expert in working and doing this thing, please highlight and please that good conditions like pain and somatic concerns and the grief and disappointments and anxiety and depression. But the very topic, the trauma focus, yes, if it is a routine once in a life, one can ignore the recurrence of the thoughts, the flashbacks, and all these things. But if it is perpetual or complex, one after another, how difficult it would be, and how much success one may expect out of, and how many sessions one may take it to make a person accept his very, very brutally gang rape or very other and perpetual sexual harassment and their trauma throughout his life or maybe bigger part of the life. So how far it is effective with this, and how long does it is sustainable, improvement is sustainable with this. I'll request Dr. Vandana to please take over the session and address my learned professionals as well as my very enthusiastic students. Thank you, Vandana, over to you.
Thank you, respected sir, Dr. Geeta, and the organizers for giving me the opportunity to be here and talk about acceptance and commitment therapy. And I know, sir has given a very good introduction to what we are going to talk about today. And it's a different approach, and we are just taking a little trauma lens into it because, as sir said, it's a very perpetual pain. And if the pain is inescapable, as well said in ACT, if pain is inevitable, suffering is an option. So let's try to learn and see if that can also work and be another approach to deal with the trauma that people face on an everyday basis. So from here, I now would be sharing my screen, and I would just want one of the organizers to let me know if they can see my presentation.
Yes, ma'am. It's
Yes,
visible.
it is very much visible.
Okay, let's do it. Yeah. So, okay. So, as sir said, since the topic is very important, I would really want to first emphasize the basic concepts of ACT, because I really feel before adding the trauma lens to it, let's see what this is. Let's unpack this. And when we unpack, I'm sure there's so much to go through, but I'm going to here primarily talk about the fundamental premises on which the acceptance and commitment therapy is based. So, as Sir introduced, it was developed by Stephen Hayes, who himself suffered from a condition, and hence all the therapy techniques are really coming from a very experiential point of view. And it relies on very important premises. The first one is that the pain, grief, disappointment, illness, anxiety, they are inevitable features of human life and suffering. So, normal human mind often creates psychological suffering for all of us sooner or later. And somehow we have learned to attach a negative connotation to human emotions. And we always try to fix it, manage it, change it, but not experience that as a part of our whole life. And, he has done so many research papers where he proves that attempts to eliminate or suppress the undesirable experiences are actually counterproductive. It doesn't help. In fact, it doesn't help, and it, in fact, amplifies the suffering. So that is a very essential assumption of ACT, that we don't have to fight with it all the time. Then ACT is also based on the theory and the concept of functional contextualism, which is another powerful concept, and says that anything, any behavior, thought can always be understood in terms of the context. Without context, it's very hard to say what's right and wrong. And more so, ACT is not interested in right, wrong, good, bad, rational, irrational. It's not interested in that. What it is interested in is a particular thought, feeling, behavior is working for you or not. If it is not working for you, then okay. If it's not working for you, then yeah, it's not helpful. And then the next, I think now the last 2 points are about the goals of ACT. So ACT focuses on expanding the psychological flexibility. I know I've introduced the term here, but I will unpack the term later in the slide. So psychological flexibility basically means that you open yourself to all the emotions, and then you are trying to figure out your life in the direction of your values and goals, which relates to our sixth point. That is, as I've already emphasized, that the goal of ACT is never to eliminate difficult feelings, but to be present with that and move towards a very valuable and a very meaningful life. So that's a basic fundamental concept of ACT. And I think we all are aware of the ACT hexaflex model, because it has like 6 basic interventions. And all these 6 basic intervention, as Dr. Hayes and Dr. Russ Harris suggest, they reduce the psychological suffering of the people. Why? Because, like you can see in the core, the heart of the intervention is be present, open up, and do what matters. So basically, if we try to unpack these 3 things, it comes down to what you're thinking. Let's not diffuse with a lot of thoughts that we have. Let's make room and accept a lot of feelings that we have. Let's come back to the present. Let's be the noticing self and notice self in the context rather than what we already believe we are. Find out the values that really matters to us, and then commit to what matters to us. So all of them together helps us to be very, very psychologically flexible individual. And what Dr. Hai says is that if we are psychologically flexible, there is no amount of difficulty that can I'm sorry, trouble us, because even if it troubles us, we know how to take it through, how to live through it. So that is the entire point of ACT. And I think once I describe this model, it is rather easier to talk about the psychological inflexibility now. So on all these parameters, all these 6 points, you can see the suffering. So when I fuse with most of my thoughts, when I avoid looking at certain thoughts, when I'm dominated by maybe the past and the future sufferings and thoughts, when I'm attached to a very fixed notion of self, when I lack my values, I don't know what my values are, and when I act very I don't act on my values, I'm impulsive, I'm not persistent. That is the whole reason why people suffer. So coming from this page to this page is actually what ACT intends for, right? As simple as that. And if this hexaflex is very confusing, I think he also proposed a very simple triflex. That is, again, being present means connecting with the present moment, considering yourself as contact, opening up to all the emotions and not going with the thoughts, and then doing what matters. That is finding values and committing to it. So, as we are now clear about the ACT model and what its basic fundamental principles and what we are trying to achieve, let's try to look at it from a little trauma lens. So, in trauma focused ACT, a traumatic event is anything that is leading to a significant degree of actual or threatened, it is causing physical or psychological harm to one person or the other. And this includes a range of condition. The range of condition varies from miscarriage to murder to divorce to death to disaster, rape, violence, torture, accident, injuries, anything, even as a transition in life, like going through maybe a surgical treatment, or maybe going for something which is a major loss of a healthy self. Any of these things can lead to a, a feeling or an experience which is very, very painful for people to go through. And that is why I think in the next point you can see I've tried to analyze and try to write what are the three ways in which you can always find out that something is going in the lines of trauma or not. Because all of us go through difficult life experience, but there are certain experiences which are more painful to us. And the way to identify them is number one, is it the direct or indirect experience of traumatic event? Have I experienced that myself, or have I experienced? So please note that I've particularly mentioned the word indirect because sometimes there is a vicarious trauma, and I think in COVID times all of us knew what vicarious trauma is. We as a community were shaken. We were shaken by the loss in the community. Similarly, they are distressing emotional, cognitive, and physiological reaction to the experience. And third one, and quite important one, is that we are not able to deal with our distress. The distress is keeping us stuck. It is keeping us, stuck in not only the cycles, but we are not able to come together and live our life happily the way we want to. So I would say these are the ways in which you can identify the trauma. And trauma focused act, I would still like to emphasize it is neither a protocol nor a particular treatment for one specific condition like PTSD. You can say it is for all the trauma related conditions, and a kind of treatment where we are approaching act with more compassion, more exposure, and more acceptance. That is what is trauma focused act is. And like I said, I think Sir also was trying to talk about that how we go through it, how many session it takes, and I think this particular page helps us to get clear with it. So clearly you can see that from this particular slide that there are three major core components. One is the beginning of therapy, where definitely we do the regular history taking, we take consent, we establish the goals of treatment, and we try to work and psychoeducate someone on trauma. But the next three are very important. That is how to live in the present while there is pain and suffering, which I would say that most it is this is the most heavy part of act work, because if you know how to do this, you can do the rest. And then the stage 3 is healing the past, and stage 4 is building the future. So let us go through. I mean, I've tried to organize my entire presentation around these particular topics because I feel it's easier that ways. However, I must emphasize this point before we go further, that just because I've written these points in this fashion doesn't mean TF Act follows a very systematic approach to therapy. So most of these techniques, they can happen simultaneously as well. Sometimes one is taken up before another, and all these changes are very much possible in Act. It never says that only do this and till you attain this, you cannot go to the next stage of therapy. It never says that. Okay, so let's move forward to the first stage of therapy, that is beginning therapy. And like I emphasized, just like any other form of therapy, here we do the clinical history taking. That is the history of presentation, symptom profile, personal history, family history, social and occupational functioning, substance use, assessment of physical, psychological health. And then we take the trauma history. Now, I have tried to write down in little detail about what trauma in history we are specifically interested in when we are doing ACT, because I think it's really important for us to know, because we have been doing the trauma history in TFCBT, in other methods of handling trauma. So here, definitely we are interested in the details of the main trauma and all the major events that happened, how it happened. But let me tell you that that's just one part of the intervention. That's not the full one. Because we are not only interested in what happened, but we are quite interested in how it is also impacting the person and their life, and in what ways it is impacting. So the second question is how they explain or understand their experience, the meaning they give to it. Third one is how has the trauma changed someone's life? So we make sure that we ask that what are the things people are doing more or less, or they have stopped doing, or they have started doing because trauma has happened in their life. So we really want to know Remember, in the first slide, I was talking about the function of thought. How is this trauma changing the way you look at your life at this point? That's a very big thing that we try to collect information on. And like any other method, we are interested in knowing clients' coping strategy, because sometimes the solutions are part of the problems. So we have to know what solutions are they really employing. And if there is some strength, we are really ready with open arms to use that strength further in the therapy. Also, we are interested in the long-term cost of these coping strategies. So this last point is really important one, because here we are in the last point itself, we are establishing the fact that many of the techniques that you may be using now, like for example binge eating or just watching Netflix, may look helpful at this point but not in the long run. So this therapy is not going to be only about what we don't do, but what we also do and what is helpful in the long run. So I think this point is equally important. Then we move on to obtaining informed consent. And as I said, I think in any good ethical practice would always recommend taking informed consent from people. But in ACT, we talk about, I mean, ACT therapist always encourages to use the choice point diagram. Now, this diagram that I've tried to place it on the right side of the screen is basically saying that we have a choice. We have a choice between me moving towards the kind of life that we want or away from the kind of person that we want to become. And sometimes what happens is that we get hooked by the away moves. And so we are not able to go here, while we are, most of the times what we are doing is actually taking us away from the kind of person we are becoming, and we don't like that. So this kind of explanation is very, very helpful right in the beginning, because what we are trying to tell people is that, look, when we work in therapy, I know it is very, very difficult, but we are just going to help you make your life make more sense to you and help you get away from things that really doesn't help you. So this simple explanation, I don't know, kind of is very helpful in bringing the client's willingness into the therapy. And it also gives a good glimpse of the work that's going to happen in therapy. We also introduce the concept of press pause button in right in the informed consent, because we are telling people that I know a lot of people don't like to be interrupted when they are speaking something very important. And then press pause is an important, maybe you can say, a PowerPoint for the therapist, because we have to tell them, look, if something is really, really disturbing you and it is really you are fusing or getting stuck in the into the pattern, I may pause you. I may pause you and I may slow you down and I may comment on what is happening with you then going forward. So we introduce all these things right in the beginning, and this therapy has gives the freedom to the client to say no at any point of time, because we totally understand it is difficult to go through so many interventions, and just because the therapist believes that let's move to the second stage, it may not be what client also wants. It's okay to stay in one stage for longer, and act is very flexible around these choices. So I think that is what we regularly emphasize when we begin therapy, that this is the majority work that we are going to do in therapy. And I just wanted to bring in here the little, I think somehow, I don't know, I work very good with audio visual methods as well. So I thought that this may be helpful for you as well to know the choice point explanation through this little small video. So I'm just going to play this, and please, any of the person from the team, let me know if you can also hear the sound. Can you? Can you hear the sound?
No.
No?
Voice is
No,
not
there
there.
is no
Voice is not
sound
there.
yet. No, not yet.
He is not.
I'm just playing it again. Now can you hear?
There was
Yeah.
little bit. They
Little bit?
started, but it started, but again discontinued.
Acha.
Yes, now
All
it
day
was there.
long, humans do things. even if it's just sleeping. Now, some things we do move us towards the sort of life we want. When we're behaving like the sort of person we want to be, doing things that make life richer, fuller, more meaningful, we can call these towards moves. Now, other things we do move us away from the life we want to live when we're acting ineffectively, behaving unlike the sort of person we want to be, doing things that tend to make life worse in the long term. We can call these away moves. Now, when things are going well, when life is giving us what we want, it's pretty easy for us to choose towards moves, to act effectively, doing stuff that makes life richer and more meaningful. But unfortunately, life just isn't that easy most of the time, and it doesn't give us what we want for very long. So as we go about our day, all sorts of difficult situations and difficult thoughts and feelings will arise. We may experience emotions such as worry, we may catastrophize, predict the worst, we may have thoughts popping up that I'm not good enough, I'm a loser, I'm a failure, life sucks, it's all too hard. Now, unfortunately, we easily get hooked by those difficult thoughts and feelings. And almost every psychological problem, from stress and anxiety to depression and addiction, boils down to this basic process. We get hooked by difficult thoughts and feelings, and we do away moves. However, there are times when most of us are able to unhook from these difficult thoughts and feelings and choose towards moves instead. And the better we get at doing this, the better life gets. So that's what this approach is all about. We're going to bring in some helpers to help you get a lot better at choosing towards moves. As a first step, we're going to help you identify your values, who you care about, what matters to you, what sort of person you want to be, and use those values to guide and inspire and motivate you to do more towards moves. And we're also going to develop unhooking skills so you can get a lot better and a lot faster at unhooking yourself from all those difficult thoughts, feelings, emotions, and memories. The more we develop our ability to unhook and choose those towards moves that really matter deep in our heart, the greater our quality of life, the greater our health, happiness, and well-being.
Yeah. So I think that was a very good way. And sometimes I play that in the session itself because some people relate to these little audio visual mode quite well. Now, going further in the stage one that I was describing, assessment and goal formulation. So trauma focused act approaches to all type of trauma and common related trauma related issues without any emphasis on the DSM or the ICD diagnosis. And when it comes to the goal formation, I think there is a lot of emphasis when people come into therapy, they often talk about a lot of emotional goals. But one of the important role of therapist here to also find out the behavioral goals from the emotional goals. So people may often, like I've just written one of the conversation where the client says that I don't want to do anything differently. I just want to stop feeling like this. I just want to get rid of these thoughts, feelings, emotions, and memories. So, what the therapist did to reframe it into a behavioral goal was like, so seems like a big part of our work here will need to be about learning new skills to handle these difficult thoughts and emotions. So, we have to convert it into what I can do to feel better rather than I just want to feel better. And then I think the magic wand question always helps in therapy because from here itself, we are saying that, okay, we are not just interested in doing the, dealing with the thought, but what kind of life you want to build. So we always ask, that suppose I had a magic wand here and I wave this wand and all the difficult thoughts and feelings, they just vanish or they are not something that you're struggling with. And then what would you do things differently? What sort of things would you start doing or perhaps do more? So I think These kind of questions are very helpful in the initial stages of goal formulation. And I know ACT is very flexible method of finding out these goals. It really depends on the kind of discussion you have, but sometimes having a little worksheet with you always helps. So this worksheet kind of summarizes what I was saying so far, that we try to find out the emotional goals, behavioral goals, the fusion which is happening, the avoidance which is happening, and what they look forward to in therapy. Moving on further, I think a very important part in the first step of therapy is psychoeducation on trauma. So, yes, we have told them in the informed consent procedure about how ACT helps people in general. But then we have to also talk about the trauma specific emotions. And often, when people enter therapy, they enter therapy with a lot of difficult feelings, and often they tend to label themselves as being weak, defective, crazy. So it's very, very helpful. First step to intervention is to facilitate diffusion, self-compassion, and acceptance by letting them know that our mind is wired to create suffering. It's okay if you are feeling that way. And I think ACT explores a very evolutionary origin and adaptive functions of emotions. And it's really helpful if you can bring in some scientific explanations of what they are going through. So, flight, fight, and freeze are our survival responses, and we can introduce this whole concept of why this happens to us. The sympathetic nervous system stirs up and speeds up, and so we get fight and flight, but sometimes it just appears futile, all these efforts. And there is a part of the parasympathetic nervous system which activates the freeze and the flop mode, which gives rise to the feeling of dissociation, apathy, and numbness. So we sit down with the client and sometimes we ask them, okay, what are these times when you go through fight, flight, and freeze? And we really spend a lot of time normalizing them and telling them that it's not their fault that they have these. They are the product of millions of years of evolution. So normalizing this, because in trauma, in pain, pain actually corners
Okay.
people.
Muka sina muka conversation
Pain
texture
cor- Pain corners people, and it's very helpful if
అదే మనకంటే లేదు
can can you
ఫ్యాన్
mute
ఆఫ్ మేడం
yourself? Yeah, yeah, thank you. So pain corners people, and it's very helpful to let them know it's not their fault. I think that's the first step to intervention. Now, I think right in the first session or the second session, it's very essential to help people learn a very little but very effective skill of dropping the anchor. Now, dropping the anchor, as the name suggests, dropping the anchor, money, if, for example, there is a tsunami of emotional turmoil and you don't really go on to fix the problem at that point of time because you cannot, you are really taken by certain memories and certain emotions. So at that point of time, what all that you can do is to find your anchor, just one thing that you can hold on to. So if there is a if agar आंधी hai, so we just need that one single tree we can stick on to. That's the approach, and that is why it has derived the name dropping anchor, because we want to switch off the autopilot mode. We want to handle difficult thoughts, and if we cannot at that moment, let's switch to something very basic and simple. So I would say I would introduce ACE as a method of dropping anchor right in the face of difficult feelings as it emerges, even it comes up in the first or the second session we start doing this. And in this, I would just go sequentially. A stands for acknowledging your thoughts and feelings. So I think this is the first and the most difficult step here, because generally, I don't know, the mind is wired in a way to protect us. So as soon as you get a difficult feeling, it immediately jumps into, oh, I don't want that, oh, let me do something else, oh, let me go to a friend or distract myself. It's very hard to stay there with a difficult feeling, and I think most of the people struggle at this first point. And when I specifically say then let's adopt the stance of a scientist and curiously observe everything that you are going through, it's really hard. It's hard, but when we let them know that okay, it will not take you off, because we are just in the process of helping you to feel more and more in control of yourself through these exercises, somehow people take the risk of doing this. Okay, and the way we do this is like that's what I've mentioned on the side, that you can just see and acknowledge everything that's showing up inside the person. And then we come back to the second point, that is coming back to your body. Coming back to your body again is tough because we are mostly avoiding or escaping or trying to distract ourselves. And when you come back to the body, it's so good to know that even in the even in the presence of something very painful, I have control over my body. I will not be totally taken off by a particular traumatic memory. So, we help people develop this skill by making these little connections with their body. And it can be as simple as what I've also written down is that pushing your feet hard on the floor, or just straightening up your back and stretching a bit, or maybe pressing your fingertips together, or maybe just slowly stretching or breathing very slowly at that point of time. The third one, and very important, was in engaging in what you are doing. So, what we are now saying, we are even helping one to drop the anchor by saying, there is a difficult thought, but then I acknowledge it is there. I am in my body, and let me also refocus my attention on everything which is around me in the room rather than just focusing on that particular thought. So, we do that by focusing on all our sensations. Like we all are aware of the 5, 4, 3, 2, 1 method of using all our senses to find out what else is there in the room to pay attention to and feel less in control by a particular emotion. So this I think completes our first stage of the intervention, and let's move on to the second. As I emphasized in the beginning slide, stage 2 is living in the present. And this is the most heavy lifting work in ACT. So we got to really focus on this part of the intervention. Now, one of the things that we have been talking about since beginning is unhooking, or what we say in a very technical language, cognitive diffusion or just diffusion. And I think to understand diffusion better, it is rather easy to understand what's fusion. So, fusion represents our tendency to get attached to a thinking pattern to the point where we cannot separate ourselves from the thought. So, we get hooked by it. And simply said, it just dominates your awareness and behavior at that point of time. And right opposite to fusion is diffusion. That is, we can consciously observe our internal processes without letting them to control us. And I think I keep adding these little cartoons in my slide because somehow I think this is very relatable. So ACT is also very rich in the metaphors that it uses. So there is this struggle switch metaphor, which says that if the struggle switch is on, then you are just caught up in all the anxiety, fears, guilt, tensions, frustrations. While struggle switch being off, money, there is anxiety. You do not want it. You do not like it, but I'm not going to struggle with it. You are taking a stance. You are saying, okay, I'm not getting stuck here. So I think by the time we explain the diffusion skills to people, they're quite convinced, yes, this can work. But I think almost 90% of the times I get asked, so then how? This sounds fancy, but how do we do that? We don't know. This looks not doable. So we have to get into the practice of doing diffusion rather than just talking about it. So let's go into the skills of it. So I've written beginning skills because these are the first ones we adopt, but we'll go to more deeper skills as well. So for the beginning skills, one is noticing. Noticing is as simple as, just letting your mind be however it wants to be and not participate in the thoughts. And, as I said, when I was talking about the A skills as well, that it's very difficult for people it's very difficult for people to do this. So therapists can start asking questions like, if I could listen to your mind, what would I hear? Or questions like, if I had to take a walk in your mind, what would I see? So a therapist is actively helping the client to, step out from the thought and look at the thought rather than become the thought. And it's always helpful to keep normalizing people that they are not thinking weird, and mind is just wired to protect us, and so these thoughts and emotions are present. The second, and I think I have been talking about this, but I still want to emphasize this, that in ACT, we are never looking at the form of thought. True, false, positive, negative, rational, irrational. We are not doing that. We are not getting there. What we are looking at is in terms of function, the effect it has on someone's behavior. So, whenever it's about workability, instead of debating or examining the content of thought, we look at how we respond to our thoughts, how these responses affect us. So, we basically ask that when you let these thoughts guide you, where does that take you? Towards the life you want or away from it? So we keep asking these questions here so that the person starts diffusing, starts looking at it rather than being it. And I think one of the very effective way of doing this is by labeling it. So it almost becomes like an entity with you rather than something that you are fused into. And once identified, it's very helpful to label them. And one of the ways to label it is saying that I am having a thought that. Now, this may look simple, but this is really very effective. And I'll let you know through this cartoon. So you can clearly see that there are two ways of responding to I'm unlovable. So I am unlovable. When you say that, you're totally fusing with the fact that you're totally saying that it's a verdict. You are unlovable. While in the second picture, you can see that the girl is saying, I am noticing that I am having the thought that I am unlovable. So it's like a three-level distance with the thought. And it definitely seems a little smaller, something which is not controlling you. Okay. And we can create even more layers to the thought. Like I have a mind have many billions of thoughts. There is one of those thoughts which is telling me I'm unlovable. So I actually created that kind of big distance between me and the thought. And that really, really helps. And we start doing it right then and there. Whenever the person starts speaking about, oh, you know what, I'm just a horrible person in the world. So we immediately interrupt, press pause button and say, oh, let's do the diffusion. I am having the thought. It's initially difficult, but people gradually start doing it's helpful and easy as well. Now, those were the basic skills. Let's also get on to some of the powerful skills of doing the diffusion. And I would say observing the flow of thought is one of them. Simply observing the flow of thought rather than participating. I know I've been talking about this, but like I said, people don't believe till they practice. So it's very, very important to let them practice. And I think the most beautiful metaphor that I've in so far in my 11 years of practice I've gone through is thoughts as leaves metaphor. It's a very effective method. Basically, where you help the person um, uh, imagine that they are sitting by the bank of the river, and that river, let's say, is just flowing. It's a live stream, and it has many, many things coming up, and it's coming up and going by. And then the person imagines all their thoughts, all their worries, all their difficult feelings, and place it on each of the leaf and just watch them passing by. So I think it's a very, I also have a 12-minute audio, a very, by one of my mentors who helped me learn this technique. And it really helps. So people initially do that with a guided way of how do they do that. And then gradually they start doing it on their own. And people come with a very interesting metaphors on their own as well. Like one of my clients, she was saying that, I imagine that I am standing on the traffic signal, and then there is a guilt bus going by, there is an anger bus going by. I am not stepping into any of it. I'm just observing it. So some of these metaphors, they're very powerful, and let's do it the client's way. I think that is a stance I take. Now, the second one, this is specifically for people who say, oh, yeah, we did it, but then what do I do about it? We just feel like we get lost. We don't go anywhere once we start observing our thoughts. So people will also come up with complaints like this. And that is why, like I said, till you practice, you don't believe. So it's very good to practice. So the second metaphor here to practice diffusion is getting in and getting out of the river, which basically means that whenever we catch ourselves in constant thought, rumination, and worry, we have a choice. We jump back into the river of thoughts or come out of it. And we can, in fact, this is something which is borrowed from metacognitive therapy as well, which is deliberate rumination. So the clients can be asked to deliberately think about something which is very difficult and let them be there for like 20 seconds or 1 minute, and then 1 minute of doing the acknowledging and coming back exercise. So more they do it, I think more they get in habit of coming back, and being the noticing self. So I think this is very effective way, and it practically it is very, very meaningful. The last but not the least of these diffusion is write, move, and expand awareness. And trust me, it works equally beautifully. So, writing down the thought is one effective way of creating the distance again. And I do it almost all the time when I ask the person, what is the thought you have at this point while you are talking about a difficult memory? They say, oh, I'm just the most unlovable person, or I'm the most horrible person. And I actually write it down with pen and paper and keep it there. And then we go on and continue talking. And at some point, client realizes that, oh, it is still lying, but I'm not controlled by it. So it's very helpful to do that. And one of the ways in which you can further do that is by continuously having the physical moments with you, responding flexibly in your body, connecting with the body in presence of a particular written thought on the table, and then expanding your awareness while you know that there is particular. So in presence of a written thought which is very disturbing, very, very difficult, I am able to move, talk, expand my awareness, come back to my body. So it just feels like I'm not hooked to it. I'm in more control of myself. So that is why this intervention works beautifully with people. Next is acceptance. And I would say there are many, many definitions of acceptance. And I would go by a very simple definition because I feel, I don't know, examples are very good methods of always explaining the concepts well. We all have heard about Rumi and the various very beautiful poem that he writes. One of them is the guest house poem, and it's also there in my slide later. So I'm just going to use that metaphor, uninvited guest metaphor, where and keep relating it to the right side diagram because it will be easy for you to relate to what I'm saying. So suppose a doorbell rings and you open it, and to your surprise, you find that there is an uninvited guest who literally bores you and lectures you unnecessarily. Now you have tried a lot to tell the person, don't come to my home, don't come to my home, I don't like it. But the person doesn't just listen and they just still show up. So one of the first thing that we do in acceptance is acknowledging, know that he's here. So we are acknowledging, we are not shutting the door off because we are tired of doing that. And then there is allowing. So we allow it inside because you have already exhausted other methods of warding him off. He still shows up. So we allow. The third is accommodate. So take him to the living room, offer a chair, cup of coffee, and then you see that he again starts with unwanted judgments and advices. Now, that is a very important point. That is a fourth one where you appreciate the help. You say, okay, thank you for your advice, but I choose to respond differently. Now, that is where the whole idea of choice point come into picture, and that is why it is very powerful to not fight against it but appreciate your ability to choose to respond differently. And so that was about acceptance. Then we have self compassion, and I would say that self compassion, I know it sounds simple, but then it's really difficult to do. So self compassion involves acknowledging your suffering and responding very kindly to yourself, just like you want to do that to someone you love. And there, in ACT, in especially TF ACT, it's not very complicated, meditative kind of intervention. It's very simple. There are 6 basic components of self compassion. I'll just name them briefly. Acknowledging pain, diffusing from self judgment, and you can see in the bracket I've written carrot and stick approach. So this is again a very famous act metaphor where we say that narrate that very famous story that a donkey has to go to the market. There are 2 approaches: you beat the stick or you feed the carrot. Which one is better? Client automatically talks about the carrot approach being better, and then you relate it with the self talk, the healthy self talk that needs to be done. Then accepting pain, opening and allowing pain. acting with kindness, that is the kind self-talk. And I think not only ACT here, the compassion focused therapy, especially by Dr. Kristen Neff from University of California, it's very helpful. She comes up with so many methods of doing the kind self-talk. And the kind hand, I'll explain it in my later slides. We do that. We act with ourselves with kindness. We validate our pain.
Dr.
Yeah,
Vandana,
yeah.
Vandana, I'm extremely
Yes.
sorry. Time is running. Already
Okay.
7 minutes are left.
Sure.
Where your session has to be moderated by Dr. Geeta. So,
Okay.
in spite
Okay.
of that, you each and every word is very, very meaningful, very good
Okay.
for time factors.
Okay. I certainly understand, sir.
Yes, please.
Okay.
Try to finish another.
Sure. Sure, I'll do that. I'll do that. And connecting with others, the last point is that pain is common and we spend time with people you care about and accept their kindness. Now, next is clarifying values and finding out the committed ways of doing it. And I would say ACT is full of so many interesting worksheets on how we find out the values, the kind of person we really want to become, and derive as we have the value, we bring it into the goals and the daily actions and sprinkle in our life and make it more meaningful. Going forward, I think one of the important concepts I would want to talk about is value based exposure with acceptance and compassion. So, almost all evidence based treatment to trauma involves exposure. Here, most of the time they talk about habituation, but the way in which, so in a very layman's language, we say we get used to it, so it gets less distressing. But one of the very big challenge to habituation was by inhibitory learning theory, which says that it's not actually the habituation which makes the changes. It's about learning new and more flexible ways of responding that brings the actual changes. And that is why in TF Act, we use the word organized contact with a repertoire narrowing stimuli to facilitate response flexibly. So that is the whole concept of doing exposure in TF Act. And yeah, I think this diagram explains it better. That is, we have all the emotions, difficult emotions, cognitions with us, but instead of inflexible responding, which takes us away from the kind of person we want, we learn to be more flexible around the same stimuli. And here we don't assess progress on the standard SUD scale, that is subjective unit of distress. Rather, we go by how present you are with the therapist, how engaged you are. Are you in full control of your physical actions? And are you willing to let these difficult thoughts and emotion be there without trying to fight or escape? So I think these three parameters remain very important throughout the step. And this is the most important slide of the exposure exercise, because after a brief psychoeducation on why we are doing it, we identify the times. Times is an acronym for the thoughts, images, memory, emotions, and sensations which are mostly avoided. And we do that by maybe remembering something painful or imagining a difficult future event, any of these methods. And then by dropping our anchor and using 1 minute ACE, we actually go on to acceptance. And I would say acceptance, we do it here by, again, a acronym name. That is, notice the sensation, acknowledge by name, make room for it, and expand our awareness around the feeling. So that is a very major part of how we accept and make room for the difficult feelings. And after this part is done, we go for appreciation, like the last step in acceptance that I was talking about, where we also talk about what is this emotion telling you? How can you do things differently in your life now? Now, there is a very important concept here, which is very powerful when it comes to trauma. That is, we almost always end the exposure with the classic self as context metaphor. That is, thoughts and feelings are all like the weather, always changing from moment to moment, but there is a part of you which remains unharmed. And that unharmed part is your noticing self. I don't know, this is very empowering to people to know that even if their one part is impacted, there's still a part which is not impacted. And I know I'm going a little forward in my slide, but I do think that I need to tell you two very important things when it comes to self as context. That is, number one, we do it with the concept of transcendent self, which was just what I was just saying, that there is a part of you which remains unaffected and unharmed. There is a whole script on your right side, the way we do it in sessions. And then we use metaphors again. And one of the best metaphor to do this is called as the chessboard metaphor. We have less time, otherwise I would have really played this video. It's very effective way to demonstrate what I was saying. We always end this exposure exercise with a compassionate hand exercise, where the client is encouraged to pick one of the hands and imagine that it's the hand of someone very kind and caring. And then they're assisted in placing the hand slowly and gently on part of the body that hurts the most, and imagining that kindness is flowing from their fingers to their body. It's very helpful, and in my experience, it has been very useful by many of my clients. Now, working with the body is not essentially the part of either exposure or dropping anchor. It's something moving forward where you also focus on mindful moments and stretching, mindful body scans, mindfulness of postures, and mindful self touch, along with maintaining a good sleep hygiene, self soothing through all five senses, and relaxation skills. Now, since we have less time, I'm just moving on to the third stage, that is healing the past. And I think so far one of the very interesting and very useful technique remains is inner child imagery and rescripting. In this method, basically, we help take a journey with the client to their past and imagine them as a young child and all the wounds they have gone through as a child. And then the person is asked to step out of their time machine, go to the child, spend time with the child, understand, explain what's happening to them, and protect them. And trust me, I've always seen people using such powerful ways of protecting themselves and talking so compassionately with their younger you. And that's very healing in the sessions. And on your right side, there is a whole script of how we do this exercise. Now, please don't confuse. I've already talked about exposure. Now I'm again writing exposure to specific traumatic memories, but this happens only when client is not able to do this exposure that we talked about. So if the client is still responding very inflexibly, then we bring into this method where the prerequisite is that the person already know all the skills, that is dropping, diffusion, self-compassion, acceptance, and then with client we take the journey and help them to go through it one by one, and we help them choose a specific memory to work on it, which is most difficult for them. And this slide looks a little crowded, but it summarizes all the techniques we have used so far to deal with these memories. Now, grieving is a very important part of the intervention, and grief is not conceptualized as an emotion but a psychological process here, where everyone has a right to grieve in their own ways. And TF Act ways of working through grief is by dropping anchor among the huge wave of emotional pain, normalizing the pain as a natural reaction to loss, fostering acceptance and self compassion, and rebuilding their lives around the core values. Another important part is forgiveness. I have written the first thing, forgiveness is a choice, because not everyone wants to do forgiveness. But some people are too consumed by the anger and they do look forward to an intervention like forgiveness. And here we begin with very, very cultural metaphors of how resentment doesn't help us. And then the medicine to resentment is forgiving. So forgiving in
Dr.
this
Vandana,
whole, yeah,
Dr. Vandana, though the talk is very interesting, but
yeah.
to conclude in next 2 minutes.
Sure. I just have 2 slides left. So, one of the ways in which we do this is getting back more in the present, dropping anchor, getting out of the river, making room for pain, and self practicing self compassion, communicating with the person who hurt in imagination. Let them know that you are hurt and you're forgiving, and offering the kindness, and returning to the values and basic ways of building life. So, I think this cartoon again summarizes it well, that if the person is not changing, you don't need to remain stuck with them, and you don't need to continue investing your efforts into that memory. Rather, let drop the struggle and free yourself from the anger, give yourself the gift of compassion, and build your life that's more meaningful. I think that is what forgiveness is when it comes to act. The last stage and the last slide is the path ahead, where we recap all the skills. Again, I've shared a worksheet how we recap, and then we talk about the future setbacks. We help people prepare for that. And last concept is post-traumatic growth. So ACT also talks about post-traumatic growth, which is basically a positive psychological growth experienced because of struggling with a highly challenging life circumstance. Some people, they report a lot of changes in them, like deeper appreciation of life and building better meaningful connections. And we always end therapy on the note that, is there something more meaningful to your life now, and what are the growth that you have noticed in yourself? And it helps people to feel that they have really grown in the sessions as well. On that, I think I end my presentation. And I really want to tell you that about the resources which are important when it comes to trauma focused act. The Reality Slap book by Dr. Russ Harris is for the layman to understand act in a very simple, self read, self help kind of format. While for the practitioners, we have Trauma Focused Act for the practitioner's guide to do this. And I must tell you that lot of these audios and worksheets that I was talking about, they are available online free in Trauma Focused Act Extra Bits. So please go through them and find it out and download. If someone is even interested to not look at only trauma focused act but just act, you can also read The Happiness Trap, which is again the layman version of act written in a very self-help manner. And for practitioners, we have Act Made Simple second edition, so by Dr. Russ Harris. So I think on this note, I'll conclude my presentation. And this is a guest house metaphor I was earlier referring to. Thank you. Thank you.
Fantastic. Fantastic. Stay blessed. Hats off.
Thank you.
Dr. Geeta. Dr.
Yes, sir.
Geeta.
Yes, sir. Yes, sir. I'm
Now
here.
you you give your comments so that.
Okay, thank you so much, Dr. Vandana, for a very informative and enriching talk on the topic trauma focused ACT, especially for explaining the very complicated concepts in such a simple manner. That was beautiful. And using a number of metaphors and most of the exercises that you told, that was very practical in terms of application. So, thank you so much for that. And
Welcome.
now I request the chairperson, sir, to kindly provide the concluding remark on the presentation.
Extremely good, practical,
Thank you, sir.
and very deep understood therapy, which you have been practicing, and you shared so many things with our students and audience. Only setback is that a time factor. Unfortunately, we have very limited timing allotment, so we could not every sentence which was spoken has a good meaning and it's reflecting of your own experience to this. Only one or two things which I would like to conclude by saying that the whole presentation has been focusing on two very important things: either fight or
I'm not able to hear you, sir.
It's not audible. Let us contact with sir.
Yeah.
Ma'am, I think due to some technical issues, Sam has been dropped from meeting. We are just waiting for him to rejoin. Yeah, he's there.
Sure.
Even your voice is also breaking.
Yeah.
He's there.
Sir, it's not audible.
My audible? Hello. Am I audible now?
Yes, you are audible now.
Yes, sir.
Yes. Another important message is that it is on psychological flexibility and free from any DSM or I rigid process, rigid notes, all any symptom, any issues, any
I think I cannot hear again.
unprecedented problem in the system.
Okay. Okay.
It cannot be limited to any you have something to do with the grounding, which is work in the to grounding and to and recover him from immediate shock.
Yes, sir.
Sajid sir, can you contact with sir
Yes,
to
ma'am.
resolve the issue?
Just a minute. Just a minute. Yes.
Maybe if sir switch off the video, then there will be improvement in the voice quality.
You can call sir and suggest the same. Nandini.
Right, ma'am.
That
Sir, if you turn off your video, probably your voice quality will improve. Geeta ma'am, can we take the questions till then?
Yes, we can do that.
Sure.
So we have received all the questions in our chat box only. So the
Okay.
first question is from Kavita.
Okay.
So she is asking about the poem name. Once again, please. The poem name that you have taken and professor's name who has put many self-compassion videos.
Self-compassion videos. Oh, that's Dr. Russ Harris. He's based in Sydney, Australia, and he has also been my mentor. And many of the audio recordings that I was talking about, which is available in the extra bytes that you can also download, is in his voice. And on YouTube, Dr. Russ Harris is a very active person. You can follow the person, and most of the concepts I was explaining he has mentioned it there also. And then he has a page that is happiness trap page, which is the book that I was referring to. There also he has come up with whole list of resources that are freely downloadable and are very helpful. So I would really redirect you to all the places.
And is there any poem that you talked about in your presentation?
Right in front of me, The Guest House by Rumi.
Oh, okay.
Yeah.
Okay. Another thing is somebody wants to reach out to you
Okay.
for supervision.
Okay.
And does she take supervisee online also?
Yeah, I do take, and I think she can note down my contact details as well. So maybe we'll be able to take it forward from there.
Yes, it is available on the screen.
Yeah.
Then there are comments that excellent presentation and great explanation, excellent presentation again. And then there is question.
Okay.
How do we make client create a safe mental and physical space
Mm,
and work on healing when they are in an environment where adverse traumatic experiences like dysfunctional parent
mm,
is present and they don't have the option or the autonomy yet to move out of the house.
yeah.
Say, for example, they don't earn yet or are students dependent on the parent.
Mm-hmm.
So in
Okay.
this,
Understood. I think it's a very good question. And you know, that's where ACT is very powerful, because despite, I think there is this line that I think I would want to, because I was in a hurry to complete, so I didn't actually elaborate on that particular. I'm sure all of us are aware of that book by Viktor Frankl. There's an excerpt from the book Man's Search for Meaning, where he writes that we who lived in a concentration camp can remember the man who walked through the huts comforting others, giving away their last piece of bread. It's difficult proof that everything can be taken from a man but his freedom to choose one's attitude in any given circumstances. I think one of the very beautiful thing also highlighted in this book by Dr. Viktor Frankl is that whatever environment we are in, because we cannot sometimes change the environment, but what we do have, the power that we do have is to take care of ourselves while we are going through a difficult situation, by totally taking care of ourselves, being aware what's happening to us, and most importantly, being very kind to ourselves. If others are talking to us in a certain way which is not helpful, or there's some problem where I'm stuck and it's just not getting solved, it's a very important thing that we focus on what I can do in any given situation and to feel powerful, right? And I think ACT also talks about, remember the 4 A's with the cartoon. So just allowing these feelings to be, let's not change it, because if we don't change it, we feel frustrated. So the very expectation is building frustration. So let's believe that the environment is not going to change at this point of time. At some point of time, it may change, and then come back to what we can do. That is, allow, accept, be with ourselves self compassionately, and then engage in something. So, even if you're financially dependent or there's some other barrier, there must be something like as simple as maybe watering the plant gives you the sense of pleasure. So, engage into something that brings meaning to you. And you can always do that anytime in your life. So, I think that, hope that answers your question.
well answered and explained. The next
Thank you.
question is from Shrajan Srivastava. What happens when acceptance feels impossible? Some horrific trauma experiences, like
Yeah.
being raped, are so horrific that
Mm,
accepting them seems like
mm,
condoning an act or minimizing its impact.
mm.
How can ACT address the specific challenge?
I think there is this it's a very good question, because there is this very specific problem with the word acceptance. Because acceptance inevitably means that you're somewhere fine with it, which you are not. So, first of all, acceptance never comes early in the intervention. If you don't have the rapport, if the person hasn't felt validated enough, if there is the safe environment hasn't been constructed in the therapy room, moving on to acceptance would be, I would say, a very premature step. And may appear very invalidating to the person. That are you saying that I just accept that I was raped? I mean, it can be very difficult feeling. So let's not go by that. And secondly, I would particularly emphasize that some people are very uncomfortable with the word acceptance. They would rather go by, let me allow some feelings to be with me. And they would rather add this with, it still means that what happened to me was totally and very much horribly wrong. So, always accepting. So, we have to keep dismantling the word acceptance for people as much as we can do in therapy. That look, I don't mean that what you went through was not important, or you shouldn't have, or it is any less painful. Everything that you have gone through is very, very deeply painful to you, and acknowledges as many times as possible, because we are not trying to just say just allow and be with it. We are saying, because often I would, especially since I've worked with the trauma survivors of especially sexual violence, I often see them talking about, this perpetrator is having such a great life, where I am, my life is ruined. They talk about that, right? So it's very important to emphasize you also deserve a very good life, and you are way more than just a particular traumatic experience. I think emphasizing these concepts really help someone to not only accept but help themselves and be compassionate to themselves, and that has to be played out all the time in whichever minor major way it can be. I hope that question is answered.
Thank you so much, ma'am. And then again, a number of comments, very positive comments on your presentation. And there
Thank
are
you.
few people who are asking for your contact number. So if
Okay.
you can put that again, the
Hmm.
contact number and everything.
Okay, I'll just write.
And if Chairperson Sir has joined back the meeting, can we go for the concluding remark? Sajid Sir? Sajid Sir, are you there?
Yes, ma'am, I am here, and even sir is also in the meeting.
Sir is also. Okay. Sir, may I request you to please provide your final comments on the presentation?
Sir, you are on mute.
Am I audible
Yes,
now?
now it's fine.
Yes, sir. Now
Yes,
you are
sir.
audible.
What I said, that it was extremely good, very functional and practical
Thank you, sir.
approach, and given by just like a speaking manual, how to handle and step to step.
Thank you,
And the
sir.
students would definitely be benefited, and they would be practicing as well as learn, maybe in through your internship under you or with you and all these things. And the last sentence, which I would once again say, that the outcome of the therapy is that, as one of the patients said, that is still there, but I am not controlled by it.
Yeah. Yes, I think that's very powerful. Hmm.
It is the gist of it, and it is the target, that
That's
it may not be possible to eliminate the thoughts which is very strongly emotionally turmoiled and very emotionally attached. But in spite of that, this thought should not control anybody, and one start living. And in short,
exactly.
that जब दर्द का हद से बढ़ जाना दवा हो जाना,
Hmm.
and that should be the whole process, that once this thought is accepted and accommodated with your lifestyle,
Hmm.
you will start working together, and you will together means with your thoughts and as well as your functions. And life has to go on in spite of all sorts of things. So the life has to go on. For this therapy is very useful, and the only thing is that it is yet to be discussed, because the time was short, that
Yeah.
evidence-based sustainability of improvement.
Yes.
Maybe
Very true.
sometime once we will meet once again in any of the
Sure.
sessions, we
Sure.
will be focusing on research findings and sustainability and the booster sessions and all these things, all these technologies. With this, I
Definitely.
think it was a wonderful session, and I was really I was really amazed with the fluency of your thoughts and speed through which we bound you to speak because of time constraint. And I must
I
bless you and
understand.
extremely
Thank you,
good
sir.
presentation.
Thank you, sir. Thank you, sir.
What to
And yeah. And I must say that I was summarizing 6 weeks, almost a 6 week course into 1 hour. So I must have also ran through my presentation. But if there are questions that still needs to be posted and the query remains, please feel free to reach out to me on the email or the phone, my contact. And I'm very deeply grateful to share whatever I could in the short duration of time. So I think Sir has very nicely summarized what we were primarily talking about, and I would love the opportunity to further talk about the effectiveness in research as well.
Thank you, ma'am.
Welcome.
Dr. Geeta, over to you.
Yes, thank you, sir. Thank you, ma'am. I now invite Organizing Secretary of Reflections, Mr. Sajid Kazmi, the mastermind behind this event, to deliver the vote of thanks.
Thank you very much, ma'am. And I take this opportunity to extend my gratitude to all the, first of all, the speaker, Dr. Vandana Madam, for taking out, accepting our request to deliver this lecture. I know that you have done a commendable job, and sorry we could not provide you with the long time gap. So, but still you tried to manage it, and I am sure that all the participants will be benefited by this, and definitely it is an ongoing journey. So, whatever questions have been left out, we will definitely either through our channel or through directly, it will be put up on various forms, and you can directly address those queries. I am extremely grateful for blessing us in this moment, because I know Sam is not keeping well, but still he stood with us throughout the session, and he has continuously blessed us. So I am very much thank my dear Geeta ma'am. Thank you for moderating the session, and thank you for keeping the pace of the session and maintaining everything well in time properly. I'm team of IMHRC. We convey our gratitude to each one of you for your patient listening, especially to our patient listeners, our audience. We have been continuously getting requests because put up the whole lecture on YouTube as well, because it is a free exercise, and
Yeah.
each one of us should get equal opportunity. So there is no restriction. You all can share it, you all can subscribe it, so that it is disseminated to a larger audience. Just one announcement before we conclude this session, that the next or the second lecture series of this reflection, second lecture will be held on, or it is will be, and we have requested Dr. Shikha Soni to deliver the lecture on interventions, positive psychology interventions in clinical practice. So we will be covering very detailed information and creative, and it will be shared to all. Thank you very much. Ma'am, we can conclude the session,
Thank you.
or we
Thank
can
you.
take a few responses from audience if they want to share anything, if they want to convey anything.
Can I say a few words, sir, if you don't mind?
Yes, yes.
Uh, Thank you so much.
Just
And
keep it brief, please.
yes, Vandana madam, it was excellent, excellent, very practical. That is what the most important thing. And thank you so much for many of the tips or the ideas which has enhanced already whatever we are practicing in our sessions. And Victor Franklin, one more thing which we need to inculcate in the clients is that sense of humor, and that spirituality will help them
Yeah.
to strengthen their, to come
Very
out
true.
of the trauma. So that one point I would like to add upon. So thank you so much for this wonderful, insightful session. Thank you, whoever has just created this group and you have done that. Thank you so much. Grateful.
Welcome, Kavita. I'm so glad you felt that this was helpful. And that was my purpose of doing this presentation, because I know when we read it in books, it appears dry. But that is why I wanted to bring out as many metaphors, as much of experience, so that it feels real, as if we are doing it in session. And I think all of us, let's start implementing it in our therapy practices as well. But thank you for the compliments as well.
Thank you. Okay, so we will conclude and end up this meeting. Thank you very much.
Sure. Sure.
Take care. Good night.
Okay. Good night, everyone.
Thank
Have a
you
great
very
week.
much.
Welcome.
Thank you.